well, we know it got into a carcass outside, so not sure if that's actually what's stuck in its intestine or if they ate something else and that's what stuck in its intestine. But on the ultrasound, it did look like there was something that was blocking things from being able to flow and move through. And it seemed big enough that we're gonna have to go remove it surgically instead of trying to let it pass like on its own. So here we go.
Yep.
Yeah, we good?
Yes.
We good.
Cutscene?
Cutscene.
You want some,
Just a little bit of saline,
just a little?
and then we can keep the rest in the warmer so it stays warm.
You got it.
Did you get it to roll up?
I did it. You love it? The whole way down.
I would say this dog is still a little dehydrated.
You think so? Okay.
Just to get it out.
I'll be a little bolus.
The tissues are pretty sticky.
Okay.
Quick question, Doc. You had it like got in there. What was your indication that it was?
So it's the tissues, the
Yeah.
subcutaneous tissues are really sticky. I'm kind of like grabbing in them instead of being more smooth. And usually that's a sign that they don't have enough fluids in their tissues.
Gotcha. Thank you.
Yeah.
I'm gonna go to the store and go ahead and flip that. Are you okay?
Yeah.
I'm,
Alright.
yeah.
Let's see how it looks.
Do we know where this one went from?
When they did the ultrasound, it was in the body. So even though we know based on the ultrasound what we think we're gonna find, we still want to take a look at everything in there. Make sure there's no surprises. Your NG tube was working pretty well?
It was pretty decent. It felt like,
It's barely in.
well,
Just you know.
okay. I feel like I got a good amount out. It looked pretty well.
So it actually made it out of the blood.
What are we at now?
All right. Got it. Things do not look as angry as I was expecting in here either.
Are you doing on coffees for this or no? It's still really exciting. So not frozen.
Probably not if it's straightforward.
Hmm?
So probably not if it's straightforward and we get out of here. It's got a little plaque on the screen. You see that? Yeah, it's called hemosiderosis. So it's like basically if you have a bruise on your spleen that then scars, that's what happens. But it's the iron from your red blood cells that kind of forms that weird coloration to it. There it is. He was working on it. So even though I found a problematic thing, you still gotta look at everything else. So this is the cecum. This is, in us, what would be our appendix, but it's a much more developed in the dog. Oh, you made it just past. You just barely made it into the chicken. And he does not want to go. So he's right where he is. Can you grab me some 3O PS on paper, please?
Real PBS on taper.
These are doyens, so these help clamp off the ingesta and keep it from coming to play and say hi.
Did you ever look across the farm?
I released it from the right body wall.
Across the farm, released. With pottery.
And then we want to make our incision on the part of the intestine that has not had the foreign body go through it. So hopefully it's not quite just off. Yeah, I released it, but I didn't remove it. Looks very round. I don't know if you got like a nut or a ball of some kind.
Is it out? Huh?
Yeah, it's a ball.
Oh, it's very round.
But it's not like there's a little point at one end on both ends. So I don't know, like maybe it's a nut or something.
It's not a ball.
It's not a nut.
Oh, I know.
picture of eyeball would break down.
I know, I don't be squishy. I'm just joking. It's Ada carcass.
Maybe Ada and Carcass that ate it.
Maybe.
Maybe.
Never know.
It's like a turducken.
Crazier things could happen.
The turkey that ate the chicken that ate the duck. So I'm going to do a simple continuous. Talk to different surgeons. Some will do simple continuous, some will do a simple interrupted. There's pros and cons to both. Simple interrupted is each individual stitch, and so it does it is a little bit stronger. It also takes longer because it's a lot more knots. All those knots have a chance to potentially irritate your incision a little bit more. And so simple continuous is a little bit faster. It also opposes your incision a little bit better, so in theory, a little bit better healing. And my opinion is still plenty strong and actually has basically the same rate of dehiscence. And that's the big thing that we're worried about, is that there might be leakage of the bacteria that normally live inside of the intestine out in the abdomen. And that's then obviously a very big problem because you're not supposed to have an infection in your abdomen. So that's usually a surgical emergency that we have to go back to. So most things that we do are trying to decrease that risk as much as possible. We do a decent job. It's for something like this, it's between 5 and 7%, but it's never zero. So we keep trying. But so I choose to do simple continuous because I think in my hands it just works a little bit better. But other people choose to do simple interrupted because that's what works better in their hands. Either way, we do something called leak testing afterwards. So we try and kind of artificially simulate for what the intestine might be doing in terms of having pressure on it or probing it for holes to try to say if there is a leak or not. So that helps a little bit. But there also seems to be more to it than that, because even from a mechanical standpoint, sometimes we can get it back together and there's no noticeable leaks, and yet they still have that infection develop. So there also seems to be some other part that we hadn't quite figured out yet on why some dogs get that infection and some dogs don't. The important part about it though is that I want to actually start my suturing before the incision that I made and end it after, to make sure that I don't accidentally leave a little gap at the end. And then you're seeing each time I'm grabbing it and holding the suture. So that's the important thing you have to do if you're going to do a simple continuous, is making sure that it stays tight. If you loosen it up as you go, then you're going to have a lot of gaps. That's the advantage of the simple interrupted, is you don't have to keep it tight as you go. Each one is its own thing. And so it doesn't, you know, if one of them is loose, that one, that would still suck, but it doesn't make your whole line fall apart. Whereas this, if it's loose, the whole thing falls apart. So then some people inject saline in it to actually pressurize it and test it that way. For me, what I was taught to do is take this little hemostat and see if I can poke it in. And when I've done both together, this is usually a little bit more sensitive, so that's why I've stuck with it. I'm trying, so I got a little bit gap there, it was a little bit too far apart, so I'm gonna put another suture right there. And these are looking pretty good. So just one little extra one right there, we should be all right. Check. Still there, so we're gonna put another one in.
Seem tacky to yourself?
No. Seems better. We're gonna put another one in just so I can sleep better tonight. So these are the doyens, so these are atraumatic forceps. So they give them to block the intestine, but then afterwards the intestines are still okay and will heal. Normal clamps you do that with and you'll actually kill the intestine, and then we have to come back and remove that section of intestine. So now we do a little local lavage, because even though we're careful, there's always a little bit that spills out. And can I have a glove change? Kelly,
Yeah?
Jeremy,
No?
have a glove change.
Yes.
Technically just did what we consider a dirty or contaminated procedure. And so in theory, there could have been bacteria and contaminants on my gloves. So I'm gonna use different gloves, different instruments for the rest of the procedure. Since hopefully I've contained whatever got loose. And now I can go back to this being a clean procedure. And I get 2-aught PDS, 3-aught monochrome, 3-aught nylon. And I'll need a closing packaging. So then we're gonna do something called omentalizing. So you just take some of this. This is the omentum, so this is the band-aid of the abdomen. It goes and gloms onto whatever needs to heal. So we're gonna put it over the incision so that it helps to heal it up. If I was really worried, I could actually suture it on there, but it's usually pretty good at staying where it's supposed to stay.
It's 2 mils.
We can just do this.
Huh?
We can do this.
But what do you want it to dilute to?
Oh, 6. And I'll ask you to do a sponge grub for me too, and get me some warm saline so I can do a flush.
My goodness.
I'm very needy.
How much flush do you want?
500 should be fine. He's a little guy. She is a little guy.
I'm gonna step out for other this year.
You good?
Okay.
Yeah. She's been good, yeah?
Mm-hmm.
Okay. And then whenever you want to do that sponge.
Pour, toss. Don't put that in.
Selective editing. And I have one lap in 7. So we're good.
Great. So I love to hear.
So we count all the gauzes and lap pads that we have at the beginning, and then before we close the outcome, we count again to make sure that we're not leaving anything behind.
Stomach, does it look full, or is it okay?
So
The
stomach,
stomach.
mild,
Okay.
like not completely empty, but very little, like a normal looking stomach.
Should I aspirate again before I estimate?
It would be worth it just to be on the safe side. Pancreas looks pretty good, so hopefully we'll get pancreatitis after all this.
I dispense gabapentin, a 50 milligram tablet, age 5 kids.
Okay. Sounds like a plan.
How often do you want that? I mean, how long?
Q8 for 10 days.
Anything else you want to send home?
We can do hydropirin while she's here.
Sorry, prescription noise.
If we're doing, I'm just talking out loud.
Okay.
If we're doing no CETA, that should be good coverage for the first 3 days. So I think that should be enough.
Okay.
Maybe just some Serenity. Just in
Can do
case.
this right now. Okay. Hydro, 0.05.
Q6 pyrin.
Six. I gave her it at 4. I'll start at 10 p.m.
Yeah.
And then I did put her down for GABA, 50 milligrams at 8 p.m.
Okay.
Does that work?
Yeah. We'll have to shift her a little bit, but let's see. I need to take that from you. If I can get a new needle.